Today we will be introducing Heels on Wheels, a mobile healthcare designed for homeless women. Homeless communities face many barriers when attempting to access healthcare support, including high rates of lost or stolen ID, preventing homeless individuals from creating health cards, and limiting their use of OHIP insurance. Discrimination is also a big obstacle as homeless individuals often feel judged by healthcare staff, therefore making it less likely they'll seek out healthcare services. Survey conducted by Homeless Hub found that approximately 34% of the homeless population in Toronto consists of women. Existing research shows that women can become more vulnerable to poverty or homelessness due to conditions of domestic abuse as well as a lack of job security. The problem we are trying to solve is the lack of accessibility homeless women in Toronto face when trying to obtain appropriate healthcare services and support for their health needs. Although homeless men also face challenges obtaining healthcare assistance, homeless women are a more vulnerable population as their respective sexual and reproductive health can potentially lead to additional risks of health complications. This is an important concern as lack of prenatal care for homeless women leads to increased risk of negative birth complications. Homeless women often opt for unhygienic methods to cope with menstruation instead of receiving sanitary products. This results in a higher prevalence of UTIs. Lastly, it's more difficult for these women to procure medication. Therefore, they must deal with heavy menstrual cramping, which can negatively impact their mental health.
For our secondary research, we try to learn about existing services, healthcare programs, and discover potential urgent needs of homeless women to get familiar with uncovered healthcare issues. According to Statistics Canada, there is an increasing trend of unsheltered women homelessness. Additionally, we found that 3/4 of the homeless suffer from at least one chronic illness, which emphasizes that it is essential to address healthcare needs and make sure that the homeless population's ability to access a stable source of primary healthcare. We did not contact homeless women directly for primary research because we recognize they are vulnerable. Instead, we reached out to 7 different organizations, conducted 3 interviews, and got the chance to communicate with 6 staff, including executive directors, to understand better the exact pain points and challenges faced by healthcare supporters and unhoused women.
The identified opportunities for change are need for access and awareness, which encompass homeless women's logistical barriers, financial barriers, and lack of knowledge regarding existing services. This can be due to a lack of trust and stigma towards medical practitioners from negative past experiences. Next is the need for continuity. Through our research, we identified that homeless women need continuity with their physicians to avoid repeating their medical state and to avoid building trust all over again. In addition, Toronto is a diverse city that is home to many immigrants and refugees from varying cultural backgrounds, which poses language and religious barriers that we identified as opportunities to tackle. Another significant consideration for our solution is the need for privacy and safety for both the medical staff and homeless women. We also uncovered several areas in the GTA that have a higher population of homeless people. Several of these areas lack stable healthcare services tailored to homeless women. We found an estimated 30% of homeless people living outdoors reside in Scarborough. Thus, our focus will operate in Scarborough.
We summarize our key findings and takeaways into the story of Khadija. Khadija is a 33-year-old female. She's from South Asia, Islamic culture, and she just been to Canada for a couple months. English is her second language. She lived in the tent community on the street of Scarborough, Ontario, as she is waiting to be arranged into a refugee home. She has noticed that her menstrual cycle has suddenly stopped, and she feels unfamiliar pain in her stomach area. She wanted to have a check, but she got tired to going to the emergency room for help, as she had negative experiences of being cultural stigma, language barrier, and being ignored.
So how can we solve Khadija's problems? Based on our research and analysis, we arrived at the following solution: a mobile women's health clinic. We proposed to set up a traveling team of healthcare professionals who will go to homeless communities to provide targeted healthcare services for women. After doing research into other organizations that address women's health, we discovered the following important services: preventative healthcare like pap smears and cervical screening, reproductive health services such as birth control, STI testing and treatment, ultrasounds for pregnant women, wound care, and consultations, both in person and virtually with nearby specialists. We will also be providing materials for DIY kits that the homeless women can keep with them. Our research helped us arrive at the following categories of items: feminine hygiene, personal hygiene, first aid, and sexual health. How will this solution help solve the problems of Khadija and other homeless women in Scarborough? First of all, we will be bringing the healthcare services to her, reducing the need for her to find transportation. And as we will travel around Scarborough, she will still have access to our services if she needs to move encampments as well. Education and information will be essential parts of our service in making sure that Khadija is more aware of the community supports available to her and how to care for her health while living unhoused. Khadija will not need to worry about a lack of money or OHIP, as our services and materials will be completely free for her. She will also have access to consistent care and will be able to see the same staff each week if she remains in the same place. We will also use a medical record system like Oscar to keep track of Khadija's visits. Our research suggests that women feel more comfortable with female healthcare providers and find them to be more empathetic. Therefore, we will look into hiring a women-only staff. Our staff will also be trained in compassionate care, so they will understand the struggles that homeless women like Khadija face and will not show any judgment or discrimination. Similarly, we will make sure that Khadija's cultural and religious identities are respected as we help her. We will partner with translation organizations to avoid language barriers. Thus, the help and the self-serve setup of our kit station will provide Khadija with autonomy to choose which menstruation or contraceptive materials she is comfortable in using. Khadija will also be able to choose between receiving private care privately within the RV or out in the open where her community can see her. Finally, we know from research that community partnerships will be essential in arranging funding, specialists, mental health support, and more. With our plan, we aim to make the healthcare network stronger in Scarborough and support the unique needs of homeless women. Thank you.